Wildfires burning in Alberta have turned the air toxic. Right now, the air quality is rated among the lowest on Earth. Environment Canada warns that certain groups, including children and pregnant women, are at higher risk of adverse health effects. To find out what we can do to protect ourselves, we're joined by Dr. Ann Hicks. She's a pediatric respirologist and assistant professor at the University of Alberta. We reached her in Edmonton. So thank you so much for taking the time. Let's get straight to it. How damaging can wildfire smoke be, especially to children?
So we have to think about it in two layers. The first one is what's happening right now. And wildfire smoke increases not only the risk of having a respiratory problem and needing to come to emergency or hospital for that, but also in the longer term, it's just like any other contaminant that you breathe into your lungs. And so over a period of time, it can cause that long-term lung damage that any other form of air pollution would also create.
And I understand that you have been treating children for smoke inhalation. What are you seeing? Just describe that to us.
I'm not sure I'd describe it exactly as smoke inhalation, but what happens is when you inhale smoke, you get irritation of all of your respiratory tissues, just like the way your eyes and your throat sting. Your lungs can get that same kind of feeling. Kids that are at increased risk particularly are infants and small children or children with asthma. And that can cause asthma attacks that are more severe when they're breathing in smoke.
So is it best to, if you do have a child with some kind of respiratory issue like asthma, is it best to keep them inside as much as possible right now?
Yeah, especially at the worst air quality. If you look at the AQHI, and I do recommend that all my children with respiratory diseases, I guess my patients with respiratory diseases, keep an eye on the AQHI. It's recommended that everyone stays indoors when the weather is this bad from a smoke perspective. But certainly, any time that the outdoor air pollution is impacting your asthma, you should stay inside. Run a air cleaner or air purifier, like a HEPA device, if you have one handy, and keep your doors and windows closed.
What about masks? Is that a good idea if you do have to go outside?
Yeah, and actually, someone named Sarah Henderson, Dr. Henderson at UBC, I think she's at UBC, has done a number of studies, and in one of her reports, surgical masks can decrease what you breathe in by about 20%, but the well-fitted N95 masks that we use in healthcare and that people use for a lot of different construction and other jobs as well for respiratory protection can keep a lot of those particles out of your lungs up to 80 or 85%.
Now, I understand pregnant women are also at particular risk. What health impacts can smoke inhalation have for mother and fetus?
So some of our systematic reviews where we look at the evidence from a lot of different studies have shown that pregnant people can have an increased risk of preterm delivery, and also that babies can be born small for gestational age, meaning significantly smaller than you would otherwise expect for a baby at their age when they're born.
Wow. You know, we talked about some of the things that parents can do right now to protect their children, to protect their families when these wildfires are going on. What else is on that list that folks can do right now?
So I think staying indoors, rethinking your plans and spending more time or, rescheduling an activity that you had planned for outdoors. People should think about daycare and school and other places that their children spend time and have alternate activities for recess and lunch so that kids can be active without being outdoors. And we need to think about using personal protection like masks and so on, and limiting the intensity of our activities when we do have to go outdoors.
You know, sadly, wildfires are only increasing. What is your biggest concern right now looking ahead?
So I think one of my biggest concerns is how we're going to deal with air pollution for everybody, and knowing that wildfires contribute to climate change as well as being a result of climate change. I think we really need to think about how we're going to protect all of our communities, and especially the most vulnerable people in every community, in order to provide them with long-term access to clean air, and access especially for people who have limited options. So things like making sure that air is clean inside schools, and that people have access to public buildings where there's clean air and access to free masks. will probably help to protect our population. On the bigger scale, climate change, we do need to deal with climate change, absolutely. But the short-term result should be everyone having access.
Doctor, certainly appreciate your time this evening. That is Dr. Ann Hicks, a pediatric respirologist and assistant professor at the University of Alberta. She joined us from Edmonton.